Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the surface anatomy of the thyroid gland. So first of all, we'll go to find out the anatomy of thyroid gland. Thyroid gland has two lateral lobes and one isthmus. Isthmus connects the two lateral lobes. First of all, we'll outline the isthmus. How can we do it? We must tell the subject to extend the neck. Neck should be extended. If the neck is not extended, we have hard time to find out the outline of the thyroid gland. So extend the neck, palpate the laryngeal prominence. Laryngeal prominence means the Adam's apple, that is the prominence of the thyroid cartilage below the thyroid notch. So this is the laryngeal prominence, and we have the just above it we have the thyroid notch. So here in this image, this is the laryngeal prominence, also called thyroid prominence, and this is the thyroid notch area. We can easily palpate it. Okay, if we can palpate that, then we can slip our finger down and ultimately we'll get this is the cricothyroid ligament, then we'll get the arch of the cricoid cartilage. Okay, once we get arch of the cricoid cartilage, then we'll draw 1.5 centimeter horizontal line across the trachea, 1 centimeter below the arch of the cricoid cartilage. So if we go there, okay, so let's go there. So if we draw a line around 1.5 centimeter, okay, so we've done that, and another line 1.5 centimeter horizontal line across the trachea, 1 centimeter below the arch of the cricoid cartilage. This is the cricoid cartilage, just 1 centimeter below. We have done one horizontal line. Okay, we have to draw another horizontal line 2.5 centimeter below the cricoid cartilage, below the lower border of the cricoid cartilage. This is also lower border of the cricoid cartilage, that is 1.5 centimeter. Now we'll go to the second line, that is also horizontal, that is again 1.5 centimeter, but it is 2.5 centimeter below the arch of the cricoid cartilage. We've done that. Okay, then we have to go to find out the lower part of the lateral lobe. So another point should be 1.2 centimeter below and lateral to the lower margin of the isthmus here. Okay, another one should be around 2.5 centimeter below from this line, around 2.5 centimeter from this point. First point is around 1.25 centimeter. Okay, we have done that. Another one is this. Then we have another point for the upper lobe, that is at the level of the laryngeal prominence, a bit lower but almost in the middle of the thyroid cartilage, just below that. So it is in front of the sternomastoid muscle. So we got another point here. Okay, suppose this is the point, then we'll draw this point to the isthmus. Okay, another one should be here. Okay, and we can draw the line to the isthmus upper border. Okay, then we'll connect the to find out the lateral border of the thyroid gland. Okay, this is that. Another one should be like this. Okay, it goes almost to the clavicle. Okay, so this is our thyroid gland, more or less. It is variable from person to person, and it is a little bit up in case of children and women, and it's its size may be enlarged during menstruation and during pregnancy because of high metabolic demand. This is the gland which secretes very important hormone T3, T4. Those are essential to maintain the basal metabolic rate and temperature of our body. Okay, so we got the thyroid gland. The upper pole is more or less pointed, lower pole is more or less blunt. Okay, that is the idea of the thyroid gland. We may have one pyramidal lobe, may go like a pyramid. Okay, we may have pyramidal lobe like this. Okay, so we got the thyroid gland here. Okay, we can do that part. Okay, we can use the eraser. So if we just take it out, then we got the thyroid gland here. Okay, so we got the thyroid gland. We try it again. Okay, we got the isthmus. We got this is the isthmus. This is the lobe. This is the right lobe of the thyroid gland. This is the left lobe of the thyroid gland. Okay, and this is the pyramidal lobe. This is the thyroid prominence or laryngeal prominence. This part is the thyroid notch. We can easily palpate it. This notch, this is the laryngeal prominence. Okay, we got the thyroid cartilage here. Now, here is thyroid cartilage. This is the thyroid gland. Okay, so we got that. Now we'll go to the next slide. We'll go there. Okay, isthmus. We've gone through the isthmus. Okay. Okay. So lateral lobe, a 0.1 centimeter below the lateral end of the lower border of the isthmus, a 0.2-0.5 centimeter below the lateral end of the lower border of the isthmus. Okay, a point in front of the sternocleidomastoid muscle at the level of the laryngeal prominence, almost at the middle part of the thyroid lamina. Okay, to represent the superior pole of the thyroid gland. So this is almost the level of the of the laryngeal or thyroid prominence. Okay, here it is a little bit down, but always there is some variation. This is the pyramidal lobe. Okay, just we'll get the isthmus here. This is the isthmus area. This is the left lobe of the thyroid gland. This is the right lobe of the thyroid gland. Okay, isthmus extend from second to fourth tracheal rings. These are the tracheal rings. Okay, we got that. So the thyroid gland is outlined by drawing the points to the lateral end of the isthmus. Vertebral level and extent of thyroid gland is important to us. The thyroid gland lies against the C5, C6, C7 and T1 cervical vertebrae. C5, C6, C7 cervical vertebra and T1 or thoracic 1 vertebra, holding or embarrassing or almost encircling, not totally but partially encircling the trachea. This is the trachea. It is almost surrounded by the thyroid gland. The thyroid lobe extends from the level of the laryngeal prominence to the level of the 4th to 5th tracheal rings. Isthmus is very important. That is usually cut during the tracheostomy operation. Okay, so isthmus extend from the 2nd to 4th tracheal rings. Okay, so to find out some of the relationship of the thyroid gland, we have the parathyroid gland posterior to the thyroid gland. Okay, and thyroid gland is overlapped by the sternocleidomastoid muscle. It is overlapped by other muscle like that of the infrahyoid muscle, like that of the sternohyoid, sternothyroid, or even partly by the omohyoid muscle. Okay, that cover it. And thyroid gland has capsule Okay, the external capsule, it is also internal capsule. Thyroid gland is also related to the structure of the carotid sheath, like that of the common carotid artery here, internal jugular vein, and the vagus nerve. Okay, so we have gone through this objective question. Okay, so we'll go through the blood supply of the thyroid gland. Thyroid gland is supplied by the superior thyroid artery branch of external carotid artery, inferior thyroid artery branch of the inferior thyroid artery branch of the thyrocervical trunk, that is a branch of the subclavian artery. Then for pyramid, we may get the ima artery, IMA, or arteria thyroidea ima, that may come from the arch of the aorta or may come from the subclavian artery. Venous drainage, the superior thyroid vein will go to the internal jugular vein. Inferior thyroid vein, maybe one, maybe two, they open into the left brachiocephalic vein. Okay, and that's all about the surface anatomy of the thyroid gland. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a wonderful day. Bye now.